Welcome to Accelerate My Practice. So glad you could join us here today, here in the AMP TV studio. Hopefully you've been enjoying the whole series we've been doing over the past few weeks, role-playing various topics. That was a request that came to us from a handful of clients of, hey, how do you handle this? What conversations do you have with the patient? And give us real-world stuff. Don't give us some scripted, boring, unreal sort of content. I really wanted to cover some of the psychology behind how to get a patient to say yes, because then we can role play that very psychology. So that's what I want to discuss here with you today is some of that sort of content, the psychology of how it all works, how it all wraps up together. And I have a fun little video we'll play somewhere in the middle about the same stuff. So if you look at the psychology of consumerism, how do people make decisions? Because your competition, I believe, is not the other dental office. I do believe your competition is Apple, Best Buy, Carnival Cruise, Ford, GM, any sort of discretionary spending that people, what they would like to spend their money on. And so the issue there becomes, how can we understand what that means and what that is? And so that's what we're going to discuss. Because when people are trying to figure out where they want to spend money, what it is they want to do, it's all about the end result, having fun, enjoying life, gaining pleasure, or avoiding pain. If you follow Tony Robbins' content at all, he talks a lot about this very topic, that people will make change for one of two reasons, either to avoid pain or to gain pleasure. People could be looking to spend their money anywhere else. And of course, the argument I get from lots of people is, well, Darren, I've got patients who are calling me all the time, and when they call, they're asking how much our fee is so they can go to the lesser expensive dentist. And my rebuttal to that is the reason why they're looking to save that $100 or that $200 or however many dollars it is because they want to save it so they can spend it at the Apple Store and the iPhone 6. And I really think if you go back to this pain or pleasure concept, you're going to see that there's a big piece of reality there that'll make perfect sense as you start to contemplate that. So what we really need to think about is how is this patient presenting themselves to us? Are they in the avoid pain or are they in the gain pleasure sort of modality? And the reason why I say that is one of the easiest cases to sell is when a patient comes to you saying, hey, I'd like a full mouth makeover. I realize it's going to be $20,000, but I want a full mouth makeover. You know, in that instance, all we need to do is answer their questions, provide value, differentiate ourselves from whoever else they might be talking to, and it's incredible how all of a sudden then they say yes to the treatment. Now, the harder cases to get accepted are the patients who come in and they aren't expecting any dentistry. They're just there for a cleaning, or so they think, and they are coming in with the anticipation of, hey, I'm just going to get a cleaning and then we're going to move on and it's no big deal. So that's going to be the hardest case when all of a sudden you're looking at them going, hey, you need a $1,000, $2,000, or $3,000 or $4,000 of dentistry that you're not expecting, and now you're shell shocked. And therein lies a massive challenge of how to do it. So there's a few things I want to discuss here in the psychology. One is the timing of how we do this. Secondly then is how are we going to actually present it to the patients, because they're going to be shocked by this and not understand what's going on. And so in their instance, they're challenged and they're overwhelmed and so if you're coming at the end of the exam to do this, they're going to be sitting there going, oh my Lord. And so we need to talk about sequencing. So what we want to do there is we want to contemplate in the hygiene exam having a patient be prepped for what this is going to be early in the appointment rather than in the last 10 minutes. So next week when we role play some of this stuff, I want to bring in some of the conversation about the monthly payments. I want to discuss some of that content and bring it in because it's germane here. And obviously I can't role play some of this here. But I think if we bring it in and we role play this next week and then button up this whole case presentation thing, I think you'll see transformational growth in terms of your case acceptance. I hope you're finding this content to be very, very helpful for you. I hope you're enjoying it. If you have questions, please email them over to your coach or to myself so we can address them and then maybe bring them in on the show next week. Until then, we will see you next week, 8 a.m. Mountain, 10 o'clock on the East Coast. I hope you have a wonderful week. Bye-bye for now. What if you could have the practice of your dreams? What's holding you back? Imagine Imagine a life where you have everything you ever wanted.